Hello everyone, I am Adarsh, Sports Physiotherapist and the Chief Physiotherapist of the Painfree Physio and Sport Rehabilitation Center in Trivandrum. We usually prescribe a foundation set of transition exercises. Today I am going to walk you through the generic routine designed to build stability, mobility, and confidence. As you return to your daily activities, let's get started.
Now let's target upper back mobility with thoracic foam rolling. Place the roller just below your shoulder blades. Cross your arm over to your chest to pull your scapula out of the way. This allows the roller to deeply reach the muscles surrounding your spine. Gently lift your hips and slowly roll from the mid back to the lower top of your shoulder. Avoid rolling your lower back or neck here. Keep your breathing steadily. Spend an extra few seconds on the tight spots you encounter to relieve that build up muscular tension. Next, let's focus on restoring essential cervical mobility, starting with flexion and extension. Sit tall with your shoulders relaxed. Slowly look down, bringing your chin towards your chest until you feel a gentle stretch along the back of your neck. Pause briefly. Then, smoothly look up towards the ceiling to open up the front of your thorax. Move only within a pain-free range. Never force the movement or rush it. From there, we transition into horizontal rotation. Keeping your chin level with the floor, slowly turn your head to look over your shoulder as far as comfortable. Return to the center and gently repeat to the opposite side. This helps untangle deep muscles, tightens that restricts your daily neck scanning. Finally, let's target lateral flexion. Without lifting your shoulder, gently lower your left ear down towards your left shoulder. Hold the stretch for a second, bring it back to the center, and smoothly tilt over to the right. This targets the upper trapezius and scaleni muscle to instantly drop the daily tension. Now, let's transition to upper back and shoulder health with scapular retraction. Bring your arms up, bending your elbow from a W shape. From here, think about pulling your shoulder blades back and down, as if you are trying to pinch a pencil between them. Avoid shrugging your shoulder up towards your ear. Hold that squeezely firm for a second to lock in activation. Then slowly return to the start. This is your go-to move for walking the posture muscles that support your neck and shoulders. Moving on, we have scapular push-ups. Get into plank position on your hands and knees. The absolute golden rule is to keep your elbows completely locked straight throughout the entire movement. Slowly, let your chest sink down towards the floor, allowing your shoulder blades to glide together. From there, press firmly away from the mat, doming your upper back towards the ceiling. This targets the serratus anterior muscle, which is vital for stable, pain-free shoulder mechanics. Finally, we wrap up the routine with a thoracic extension on stability ball. Carefully wrap your mid to upper back over the curve of the ball, letting your arms fall open to the sides. Relax your hip and let the gravity do the work to gently open your chest and reverse that daily forward slouch. Hold this position. Take a deep, controlled breath. Allow the spine extension to release any remaining upper body tightness. It's the perfect way to rest your posture and finish your session.
Perform these exercises 3 times a week. Focus on quality of movement rather than speed. Stay active, stay strong, and I'll see you at your next check-in at the Painfree Physio and Sport Rehabilitation.